welcome you all. The Including Me webinar series is to provide information, resources and support for all communities across Cheshire and Mersey, so that any information for families can be shared in different social media settings. And we are going to discuss key health priorities. Today's session is on vitamin D, and particularly in pregnancy.
Hi, my name is Benin, Community Engagement Lead, Improvement Team. So would you like to, the guest, would you like to introduce yourself?
Yes, that would be great. So Ala, would you like to introduce yourself?
Hello, yes, my name's Ala Abdallah. I'm a graduate from Liverpool John Moores University and I'm a pharmacist.
Thank you. Dr. Ahmed Elman?
Ahmed is going to join late.
Okay, Dr. Fiza Salam?
Hi, so I'm Dr. Salam. I'm a GP at Brownlow Health and the Racial Equality Lead for Liverpool Network Alliance and the Deputy Chair for Central Liverpool Primary Care Network.
Dr. Salam. Ruqayya Ali?
Can you hear me? Yeah, hello. My name is Ruqayya Ali. I am a student of public health and a graduate of microbiology. I am a researcher of public health and a blogger of public health. So that's why I'm interested in these two webinars.
Thank you. So Ruqayya Ali is public health researcher. Thank you. Dek Gutali?
Hello, my name is Dek Gutali. I am the chairman of Liverpool Somali community and I'm here to listen and take a note of the presentation. Thank you.
Thank you. And my name is Rita Aria. I'm an obs and gynae consultant at Warrington and Halton Teaching Hospitals. Catherine's there. Catherine, would you like to introduce yourself?
Yes, hi, my name's Catherine McLennan. I'm the programme director for the Women in Health. Sorry about the echo. For the Improving Me programme. So the Including Me webinar series is within my programme team. So I work with Decca and Bannon and Danny.
Thank you. And Lorraine, would you like to introduce yourself, please?
Oh, hi, sorry, I'm a little bit late. I work alongside Catherine, the team. I'm the programme manager.
Thank you. We'll move to the presentation about vitamin D, and then we've got some questions that have been picked as the sort of commonly asked questions from local women, and we'll go through that with all your help. Thank you, and it'll be quite interactive. Thank you.
Yes, I am Decca. I am working with Benin as part of the community engagement team. Today we're going to talk about the importance of vitamin D during pregnancy. And vitamin D, as you may know, plays a vital role in bone health, as it reduces the risk of bone fracture, promotes calcium absorption, and is needed for bone growth. It helps your baby's bones, teeth, kidneys, heart, and nervous system to develop. Severe vitamin D deficiency can lead to a child having soft bones, which can cause rickets and bone pain caused by a condition called osteomalacia in adults. Lack of vitamin D increases the risk of chronic diseases such as type 1 and 2 diabetes, certain types of cancers, coronary heart diseases, and infectious diseases. While its main source is the sun, vitamin D is also found in some foods, including oily fish such as salmon, mackerel, eggs, red meat. Vitamin D is added to some breakfast cereals, fat spreads, and non-dairy milk alternatives. The amounts added to these products can vary and might be only small. As vitamin D is only found in small numbers of foods, whether naturally or added, it's difficult to get enough from foods alone. Someone is vitamin deficient when the level of concentration is less than 30 nanomoles per liter. A level of between 30 and 50 nanomoles per liter is referred to as insufficient. In the UK, epidemiological studies have shown evidence that lower vitamin D status is highly prevalent, making it a big public health issue. A study found out that over 50% of Asian people were severely deficient, and over 30% were deficient in Black Africans, while Europeans had the lowest prevalence. Many are still affected, with a rate of 20% for Chinese participants. Who is most at risk of vitamin D deficiency? Whilst it affects people of all ages, certain people are more at risk from vitamin D deficiency. For example, people who cover up most of the skin when outdoors. For example, if you cover your skin when outside or spend lots of time indoors. People who have housebones, people with darker shade of skin, for example, people from South Asian, African, Caribbean, and African backgrounds, pregnant women, and those who are breastfeeding, people who have a BMI above 30 and classed as obese. I will pass on to Benin for the rest of the presentation.
Vitamins, supplements, and nutrition in pregnancy. Eating a healthy, varied diet in pregnancy will help you get most of vitamins and minerals you need. The Department of Health and Social Care advise you to consider taking a vitamin D supplement. Do not take cod liver oil or any supplements containing vitamin E, retinol when you are pregnant. Too much vitamin A could harm your baby. Always check the label, and you also need to know which food to avoid in pregnancy. Look at the NHS website. Vitamin D and pregnancy. Recent studies have demonstrated that vitamin D need to be administered as early in pregnancy as possible. In fact, it appears to be critical to provide vitamin D in the preconception and or preterm birth. This is likely due to the fact that vitamin D is essential in the first trimester of pregnancy to ensure proper placental development and lung development during this important period to prevent childhood asthma. Vitamin D supplements. The Department of Health and Social Care recommends people to take daily supplement containing 10 micrograms of vitamin D during the autumn and winter. People at risk are advised to take vitamin D supplements all year round. Coronavirus update. It is important to take vitamin D as you might have been indoor more than usual this year. You could take 10 micrograms, which is 400 international units of vitamin D a day between October and early March to keep your bones and muscles healthy. There have been some reports about vitamin D reducing the risk of coronavirus, but there is currently not enough evidence to support taking vitamin D to prevent or treat coronavirus. The Department of Health and Social Care recommendations: breastfeed babies from birth to 1 year of age should be given a daily supplement containing 8.5 to 10 micrograms of vitamin D to make sure they get enough. Formula-fed babies should not be given vitamin D supplement until they are having less than 500 mL, about a pint, of infant formula a day, as infant formula is fortified with vitamin D. Children aged 1 to 4 years old should be given a daily supplement containing 10 micrograms of vitamin D. Women and children who qualify for Health Start scheme can get free supplements containing vitamin D. You can also buy Health Start vitamins at some GB clinics and vitamin D supplement cheaply as at a pharmacy or supermarket? Thank you so much.
We picked some questions which are the most commonly asked questions from local women, and we'd be grateful if the guest speakers could contribute to some of the answers as well.
The first question could be for you or Faiza. Anyone, if you can answer it. When patients are made aware that they are vitamin D deficient, why does the GP not specify the exact level of deficiency and do not explain what is importance of vitamin D is? In addition, why there is no follow-up once the patient finishes the first dose?
Thank you. So, Dr. Salam, would you like to start on this really? So when people are, obviously they're taking their daily supplement of 10 micrograms, which you mentioned in the presentation, 400 international units, but if somebody is vitamin D deficient, how long should the GP give treatment for, and you know, kind of dosaging about that really?
So believe it or not, that is a surprisingly complicated answer. So depending on who's diagnosed with vitamin D, they may give you a different regime. So it may be that you take something daily to treat it, once a week or twice a week. You may end up needing to take it for a few weeks. You may need to take it for a few months. And what it's to do is the type of drug the GP prescribes for you. And often that can be influenced. So for example, not all preparations are halal. Not all preparations are kosher. Some aren't vegetarian friendly or vegan friendly, and some contain nut products. So what we give you will influence how long you take it and how long for. In terms of how deficient are you, I must admit from our perspective, it doesn't really matter if you're a little deficient or very deficient. The important thing is you're deficient and you need treatment. So perhaps we don't explain that clearly enough, and in which case I am sorry about that. In terms of follow-up, so actually everyone should have follow-up bloods. So you should have a follow-up calcium check at 4 weeks, and that's to check if there's any underlying health problems, which might show itself after vitamin D treatment. But your vitamin D levels, we wouldn't normally check as a GP until 4 months later. So if your GP hasn't arranged that, it is important to get in touch with them. There is one sort of slight caveat to that. So the guidelines the GPs follow are slightly different to the guidelines the hospital doctors follow. So if a hospital doctor's asked for a specific type of treatment, that blood test would be in 6 months, not 4 months.
Thank you so much. That's a very detailed answer. And thank you for pointing out about some of the supplements not being halal, and you know, checking about nut allergy as well. That's very important. And often the follow-up, etc., is done. We're looking at the bloods, isn't it, and the levels. Yes. Also of note, really, they suggest most people living in the north of England are deficient, and certainly in pregnancy, we do advise every woman takes the supplement. Initially, it was, you know, women who were higher risk, such as obese women, but we're advising, you know, the NICE guidelines on antenatal care and pregnancy advises that all women should take vitamin D supplements throughout pregnancy, because pregnancy itself also affects bone health. And so, you know, it's important to have an extra supplement. Thank you. So if we move on to the next question, please.
Yeah, the second question for pharmacist Ala Abdullah. When pharmacists provide medicine to the patient, why do most of them do not mention or explain how the medicine should be taken? And this is particularly important for those patients whose English is limited.
Yes, I think it's a very important question to ask. The majority of medicines that are dispensed within community pharmacies, the patient will receive a label affixed to the medication, which will tell them how to actually take that medicine, how much to take, how frequently to take it. and if the prescription specified for how long to take the medication for. And the nature of community pharmacies is that they are very busy places with a lot of prescriptions that need to be processed within a particular time frame. So although at the outset vitamin D may not seem like a sort of like a high risk medication that the pharmacist would need to speak to every patient about, I can definitely see where you're coming from where language is a barrier to communicating that information to the patient. Through my personal experience, I have noted that sometimes if the patient themselves doesn't have good language, good English skills, they'll have a relative or a friend or a neighbor that would be somebody that you could, communicate that information to. So maybe getting a telephone number for someone who has better language skills in order to relay that information later on to the patient. A lot of medications do have translated patient information leaflets that on request, from the patient, that could be supplied to them from the community pharmacies. But I think definitely the onus needs to be put to the patient. If they don't know how to take that medication, they really need to ask, whether it be that they just ask the pharmacy staff who could, simplify the instructions to them, or they could ask to speak to the pharmacist when they've got, a bit of time. But it definitely needs to be the patient. If they don't understand, don't just take the medicine. Ask how you should be taking it in order to remain safe and get the most benefit from it.
Thank you very much. Are there within pharmacists any resources you use for any translation services that you can use, any digital services? I know that some women that we see here do have apps to translate, from English into their language, particularly Eastern European women. Otherwise, we tend to use translators on the phone. But do you have any resources in pharmacy, or is there any training on that or advice on that?
A lot of the time you can contact the drug companies that supply the medicines for translated versions of information leaflets. I don't know any apps off the top of my head, to be honest with you, but it's definitely something that you could ask the community pharmacists about. I'm sure where there's a multicultural community, there will definitely be resources available. Yes, thank you. That's a great answer. Thank you. So next question, please. Danny, are you doing that one, or?
I have it, yes. Rita, this question is for you to answer. What are the early symptoms of lack of vitamin D?
We mentioned in the presentation, for children, it would affect bone development and can cause rickets. So this can cause deformities, particularly in the long bones. And you can notice this with children walking, but also children not growing to their full potential. Children tend to be under the health visitor, until they attend school. But if there's any concerns about growth or, bone health, also walking, which is called gait, a medical term. So that's how it would present with children. In pregnancy, again, it can affect the baby's bones, and you can see evidence of rickets on ultrasound scan, because bones are very white, which is the calcification. But if there is a problem like rickets or osteomalacia in babies, the bones don't look as white on ultrasound scan, and then you can do mum's blood tests to confirm that. Babies can also be smaller, and lack of vitamin D can also increase the risk of preeclampsia, which is high blood pressure in pregnancy, which presents after 20 weeks, and can also cause protein in the urine. And obviously it can affect breast milk production as well. It's important for breastfeeding mums. In adults, we talked about osteomalacia. I'm sure Dr. Salam will know more, but that this can cause bone pain, muscle weakness. So this is how, it can present and lethargy, and that's when in primary care, GPs might do vitamin D levels. And vitamin D lack also can be associated with heart disease. So it's good to do bone screening when you're investigating a patient for heart disease. Dr. Salam, do you have anything to add at all?
Yeah, absolutely. One of the other ones that we get a lot of people requesting vitamin D because they feel tired all the time, but actually that's not a symptom of vitamin D. It's more a reduction of your physical function. So you get this sort of overall chronic widespread pain, or you get sort of particularly in the back or the hands and the arms and the legs, this deep throbbing pain. That can sometimes make it quite uncomfortable for you to sleep at night. You can't quite get comfortable. If you're having a lot of chronic symmetrical pain, so that's pain that goes across the whole of the lower back, and you've tried, some exercises and physiotherapies and things are not improving, that might also indicate a vitamin D deficiency as well as sort of the general muscle aches and pains that my colleague mentioned earlier as well.
Thank you so much. Thank you.
I am wearing a headscarf. Will I get enough vitamin D if I let parts of my arm and legs exposed to the sun while in my back garden?
Can I take that one?
Thank you.
So guidelines say that if your face, so just your face is exposed and your arms are exposed for 30 minutes between 9 AM and 3 PM for 30 minutes twice a week, so not every day, between April and October, that in theory is enough sunlight to maintain your vitamin D levels. However, and that's the key, however, I think if you are an ethnic minority and you do wear a headscarf a lot of the time, or you're planning pregnancy, I would just advocate actually taking a vitamin D supplement of about 400 international units a day. And the reason for that is how we get vitamin D. So it's a specific type of sunlight called ultraviolet B. And actually in England, our sunlight isn't that strong. It doesn't contain that much of that type of sunlight, even in the summer. So actually kind of loading up in the summer months, there isn't enough in the winter sun to kind of boost you through the whole 12 months. So as a GP, I would say still take the supplements as well as a little bit of sunlight.
That's brilliant. So that tells us the months where, it would help. And you said between 9 and 3. That's brilliant. Generally around lunchtime, isn't it? Sort of 11 to 3 more so, but we carry on taking this supplements, but also safe sun. We have to be safe in the sun as well. Ensure we have use sunscreen. Should we take the next question, please? Yeah.
Yes, our next question is a question that came up a lot. People were asking, ladies, why are people with darker complexions more likely to be vitamin D deficient compared with their white counterparts?
Okay, should I start off with that one? So when we have darker skin, we have melanin, which is a pigment in our skin, which gives the skin colour. And in darker skin, we have more melanin. And melanin protects the skin against sun, but it blocks the vitamin D absorption. It affects one of the skin layers. There's like 2 layers in the skin, and it affects the architecture of this. So it blocks the absorption. So when we have darker colour, we have more melanin and we don't absorb the vitamin D from sunlight as well, because melanin reduces this ability. Dr. Salam or anybody else have anything to add to that, really?
I think what's important to remember, though, is having dark skin, evolutionary speaking, is pretty awesome. It protects you from skin cancer, which can be really harmful. The trade-off is that it's harder and less likely to get sunburn, which is not fun. So the thing is the trade-off for that is it's harder for you to absorb vitamin D. And I remember earlier I mentioned about a certain type of sunlight, ultraviolet B. The closer you are to the equator, the more abundant that is. So evolutionary speaking, having darker skin to protect you from cancer and painful burnt skin was way more important because you were getting enough vitamin D. But unfortunately, as we move away from the equator in England, Still great, you're still protected against cancer, but we just have to counteract the reduced sunlight.
Thank you very much. Okay, we'll move on to the next question. Thank you.
The next question, when people are prescribed the higher monthly dose of vitamin D, will they be required to take it for no longer than 6 months? Or will they be able to continue with a daily dose of 10 micrograms?
So I'll hand it over to Dr. Salam if that's okay, but I presume it would depend on the blood levels which the GP would check at 6 months to decide about the daily routine supplementation. But Dr. Salam, what's your view on this?
So what's important is don't overtake vitamin D, because actually too much vitamin D can be bad for you. So do take what the doctor prescribes you. Bearing in mind, you know, what you are given and what a family friend or a relative may be given may be slightly different frequency, because they're given a different concentration. And then what happens is when your levels are checked at 4 months or 6 months, if your levels are fine, then your GP would recommend taking an over-the-counter supplement to maintain those levels. And if you're no longer deficient, but it's not quite normal, so we call it insufficiency, which is this space in between, the advice is still take over-the-counter supplements, and then you keep that to stop yourself becoming deficient again. And the reason why we say that is when you're insufficient, because you've had that what we call a loading dose, that big boost to push you into that zone, over time with the supplement, that will just slowly get better. And in the insufficient range, you shouldn't have symptoms. But if at 4 months and 6 months you're still vitamin D deficient, or you're still having symptoms, which is important to tell your doctor because we might need to recheck, they will have a conversation about what to do next, or if they need to do any other blood tests or any other investigations.
Thank you so much. So that answers that and tells us about the daily supplementation. Can I ask you about your views on children taking vitamin supplements? There are lots of supplements available over the counter in pharmacies and in supermarkets. And lots of paediatricians do advise that their own children take supplements. What's the view from general practice on this?
Do it, basically.
Yeah. And would you advise, you know, you get these like gummies, little like ones like sweet, strawberry flavored, etc. And they have, you know, other vitamins. Would you advise just vitamin D or any sort of general supplement that's age appropriate?
So this is probably going to be a very GP answer to this. Give them what they will take. So if your children love gummies and they're much more likely to take a multivitamin which looks like a sweet, give them that. If they don't like the taste and texture, then try a different brand. So I'm actually probably a little bit of a GP answer there. Whatever makes things easier for mom and the little one.
Yes, no, thank you. And Banin, have you got a question on this?
Yes, Dr. Faiza, I've been taking vitamin D for a while, and nobody explained to me which one is the halal one and which one is non-halal. Maybe I'm taking the forbidden one for a while. So what's the difference?
Okay, so it's to do with the drug company and what they use to help the vitamin D stick together. So there are different versions. When vitamin D initially sort of came onto the market quite a while ago, there was only a liquid form that was halal, but there are now tablets and capsules that are halal as well. If you've been taking it for a while on prescription, then what to do is check the information on the packaging. It should tell you if it's halal or not. If you don't know, get in touch with your GP.
Thank you so much for explaining that.
My pleasure.
Yeah, I mean, the other thing that's helpful, Dr. Salam, is you can look up the drugs and the summary of product characteristics. We shouldn't really rely on patients having to do that. But if you ever want to look up a drug, SPC, you say in the BNF, it should tell us as well if things, you know, drugs are halal or, you know, appropriate for allergies, etc. But, you know, GPs will be able to find out. And also we can tell the community to always ask when they're being prescribed. about what are the side effects if somebody's taking vitamin D permanently. Dr. Salam, can you answer that one?
Sure. So as long as you're taking it in safe amounts, so no more than 400 international units a day if you're buying an over-the-counter tablet, unless your GP advises you otherwise or your doctor advises you otherwise. So taking that daily supplement won't harm you. It's not high enough to cause what we called vitamin D toxicity. But when the doctor prescribes you what I mentioned earlier, loading dose, so if you're very deficient, you have to be on a much, much higher dose. It's really important to read how to take it properly. So, you know, if you take it too frequently, then actually you may give yourself a vitamin D toxicity, and that can interfere with your calcium levels and make you feel very unwell. And that's the reason why your GP should check your calcium levels 4 weeks after starting.
Thank you. That explains that really well. Thank you. So the other thing we didn't mention is in pregnancy, lots of women can get Healthy Start vitamins. You know, they may be eligible to get that. There is a website on that. So just to mention, that's another source of being able to get the vitamins appropriate for pregnancy. I don't know, also, it could be that you can get vitamins for children through this as well. Generally, lots of women would take something like Pregnacare or Pregaday, and this would have what, you know, it doesn't always have vitamin D in, but this generally has the supplements that are recommended for pregnancy in the correct dosages, because, for example, you know, you can take too much vitamin A, which can be harmful. You can always find out if you know, if you're eligible for Healthy Start vitamins, but otherwise, I'm sure, you know, because obviously prescriptions are free once you register your pregnancy, your obstetrician or GP may be happy to prescribe. Dr. Salam, would you like to come in there?
Yes, of course. So over the counter, you can buy multivitamins that for pregnant ladies with vitamin D. My only advice would be is speak to your pharmacist. So some of the brands, you know how I talk about needing this minimum dose of vitamin D to be effective, some brands are below that dose because it makes the tablets smaller, so they sell better. So I would, and the problem is it's confusing when you're reading the back of the package. I will hold my hands up. I'm confused by it, and you know, when I was looking, so I would say chat with the pharmacist if you're not sure which one has enough in it. In terms of your GP prescribing it, so the guidelines are that GPs have to follow is we're not meant to prescribe the multivitamins and the over-the-counter, and this came from NHS England doses. We're only meant to prescribe the loading doses. Yeah. However, your GP may make an exception based on personal circumstance. So if you do feel actually an exception needs to be made for you, do speak to us. So an example would be, you know, I would prescribe it for someone who's pregnant and homeless. I would certainly make exceptions for exceptional cases, but unfortunately the Pan-Mersey guidelines that we have to follow is that we shouldn't be prescribing them if they're available over the counter.
It's true, yes. I mean, another common drug taken in pregnancy now to prevent preeclampsia is aspirin, as per the NICE guideline, which is available over the counter, but when it's a vitamin or a supplement, it's just different from an actual medicinal product, really. You're correct, yeah. If there's any queries about information, then the NHS website is helpful in terms of, you know, the dosages, supplementation, and also it's got this Healthy Start website on it. So you've got another question about pregnancy, I think.
Yes, it was about, it's about if the pregnant lady is deficient, will it affect the unborn baby? And also when born, will that baby be also deficient?
Yeah, so if the pregnant lady is very deficient, as mentioned before, it can affect bone development, which we can see on scan. There are different kinds of rickets, and we can screen the pregnant lady's levels of her calcium, vitamin D, and also we can screen genetically to see which kind of rickets it is. This is usually seen with severe rickets, where you get delayed bone development during pregnancy, seen on ultrasound scan. It can also affect the birth weight, and the baby can be small. And babies that are small are more likely to require neonatal care, go to special care, and have feeding problems, temperature control problems, and also can have hypocalcemia, which is less calcium. And that can make babies a bit more irritable, crying more, requiring more milk, and affect the baby's growth after birth as well. Rickets that's so severe that's seen in pregnancy is very rare. So while I've been a consultant at Warrington for 13 years, I've only come across 2 cases. I have seen more cases when I worked in central Manchester, where there was more of a ethnic diverse community. But I think since the 2008 NICE guidelines on antenatal care has recommended vitamin D, and since guidelines on obesity has recommended vitamin D, these cases are more rarer, thankfully, within the UK. But it's certainly something to share with friends and family who are pregnant abroad as well, because vitamin D supplements are easily available. Ala, have you got a point? Yeah, thank you. A question?
Yeah, I've got just a personal note to add to this. This is a topic close to my heart. That's why I accepted the invitation when I was asked. I had my firstborn, and within a year I was pregnant with my second, and I was taking a vitamin D supplement myself. And when my youngest was born, she was fine. She was normal birth weight, but her development, I started to notice, was delayed. Her movement, she started crawling at 9 months. She started walking at a year and 6 months. And when she started walking, she started with a waddling gait, and her back was really curved. I took her to the GP. Anyway, to cut a long story short, I think we really need to stress the importance of vitamin D for during pregnancy for the mother, but while she's breastfeeding the child, for her to take the vitamin D and to give her breastfed child the vitamin D, which I wasn't doing. I just took the vitamin D whilst I was pregnant. And my youngest actually has, she's been diagnosed with rickets, and it's quite shocking how something so small that we don't really consider the significance of in the first instance can actually have such a profound effect on the development of a child. So that's what I really wanted to stress when Benin actually invited me to this webinar, is that we really need to stress to the pregnant woman to take it during her pregnancy, but while she's breastfeeding her baby, for her to continue taking it and for her to give it to her baby as well, especially when, like me, she's from a Black or Asian or minority ethnic group.
Thank you so much, Ala. That's true. Also, it's important to be taking while you're breastfeeding. Could you also explain about the breastfed baby you're talking about as well? That the breastfed baby, breastfeeding has got multiple advantages, but those babies are more likely to have less vitamin D. That's what you're saying, Ala.
Yes, that's correct. Yes, and that's what they're recommending now, that the breastfed baby is also given a supplement as well throughout their period of being breastfed. But also, I think what I probably could have done more of was when I started weaning her, was to give her more calcium-rich foods as well. That's another thing, for the mother to maintain her calcium intake, a good calcium intake, and for the baby whilst weaning, whilst being breastfed, also to give them a good calcium intake as well.
Yeah, so certainly health visitors, and also running groups in terms of for new mums on weaning, and best foods to try is very important, and to use sort of when weaning, using full fat milk for, say, cereals and things. Could you explain about the supplements given to babies who are being breastfed? Because I'm not aware of are they drops, or how are they given, please?
Yes, they are. They're available as drops, and you can buy them in most health food shops. Holland and Barrett's to be, an example to provide, and it tells you on the package how many drops to give to the baby, at what age. So they are available. They're also, if you ask at community pharmacy, you should be able to get a recommendation for one that's appropriate.
A very important point there, and but we must promote breastfeeding within our community. And support mothers, because there's multiple advantages, and we could run a webinar on breastfeeding in the future, so that the information is shared. But that's really helpful, Ala. Is there anything else from the questions that we've asked and things we've talked about from your experience you'd like to share? Is there anything that you think we've missed out, or from the pharmacy perspective?
There's one thing that I would like to mention, if that's okay.
Thank you, yes.
Just leading on from Anna's comments, and thank you so much for sharing such a personal story with us. I think one of the things as well is the importance of taking it during pregnancy and when you're breastfeeding, but also planning for pregnancy. The way I compare it is, we don't leave our home without checking we've got our wallet, we've got our handbag, if we've got children, pretty much the whole circus and everything else they need as well. So I think when it comes to that time in life, and that point in life does differ from woman to woman about planning for pregnancy, making sure you're taking vitamin D beforehand, so you've got plenty of it before you get pregnant. Your folic acid is so important, and checking if you need the higher dose folic acid to protect baby's spine, which you get through your GP, and being as healthy as possible, just to really make everything so much better for both of you during the pregnancy and birth.
So thank you, that's very important. Preconception planning. And also for health conditions as well, to ensure you're in the optimise your health with blood pressure control or diabetes control as well. So it's really important. Has anybody got any other comments or questions or anything that we could share? We've had a breadth of questions about children and pregnancy and general health. Anybody got any comments? Please raise your hand. Yeah, thank you, Ala.
Yeah, it's just a quick point regarding pregnancy and the wonderful things that come along with that, the sickness, the nausea, the vomiting. I think we just need to point out to patients, if they have taken their dose of vitamin D or folic acid or whichever medication they're taking, if they've unfortunately brought that back up by vomiting, within 20 minutes of having taken the dose, to take it again for that day. I think that's just a point some people really might have on their minds.
20 minutes, that's very helpful to share with the community. That's true, because folic acid can be difficult for women who are really struggling with the vomiting. The other thing is, I wanted to bring up the NICE guidelines on vitamin D deficiency. That's really for adults, but that's quite a helpful guideline to dip into as well. And any NHS website, the actual NHS website, if you search vitamin D, a lot of helpful information comes up as well. So go on, Rakaya. Yeah.
Is the drops, the vitamin D drops for babies, are they available now for working moms? You said they are readily available. Are they available, or because when I wanted, I couldn't get it? So are they now? Is the circumstances changed, or is just available for voucher?
The drops, I was just communicating the fact that they're available at health food shops. So places like Holland and Barrett's, they sell vitamin D drops, which are available to the public. So I'm not sure about the Healthy Start scheme ones, but this is just that I've personally made the decision to buy them.
That's really good thing, because at the beginning, the health visitors will advise you, will tell you, because I had no idea. It was my first pregnancy. I had no idea. That was the reason I knew to give my baby some vitamin D. And then when they give me the start package with the vitamin D drops, when I ran out, there was no way to buy. I asked my health visitors, and they said, okay, the only way to get is with a voucher, and they will give you the voucher. But if you are working, you are not eligible for voucher, and you cannot buy it. It was like catch-22. Like, I cannot get the voucher. I cannot even pay for the voucher, and then I will not be able to get from the pharmacy without the voucher. So that is the catch that's something that definitely needs to be sorted out. In my opinion.
Yeah, we should be able to buy over-the-counter medication, with help from your pharmacy. Bannon, do you have a question?
I was just thanking Ala for her comments on breastfed babies, which is really something that have a great impact for many of our communities, and making it aware, it will be a great facilitator for those ladies and their kids so that they don't suffer.
No, that's really helpful. Yeah, thank you. I've learned something there as well. I knew that breastfed babies didn't get the vitamin D that artificial feeding babies did, but I didn't realise the drops were available. So it's important to share that. So thank you, Decca, Banin, and Danny for your help with this, arranging the webinar and the great presentation which we can share. Is there any closing remarks you'd like to make at all? Or?
No. Thank you very much for taking part. It was a very interesting subject, and I'm sure it will help our communities to know more about this subject.